Well, I was doing a lot of projects around the house and building things and doing a lot of strenuous lifting and pulling, and I think that might have caused it, trying to, lift heavy beams overhead and pull things up from the ground. I did have a little incident where I, was starting to fall and I caught myself and I felt a little pinch in the shoulder, but I think that it was probably maybe something that built up over the years, and maybe that was just kind of like an incident that maybe finally did something to it. I noticed that when I was trying to do lateral movements or anything that would involve, pushing this way or this way on my hand, and I was getting pain up in here. So I went to see my doctor, and then he, didn't really know what to do for me, so he sent me to his orthopedics.
He had a lot of wear and tear change, perhaps more than you'd expect for someone his age. He's lived a life of high activity. He's quite an outdoor guy, does a lot of boating, canoeing, that kind of stuff.
Now show me, just with your arms straight out in front, how high you can get it. Good, good, great.
Rotator cuff related problems that we see that are very, very common are usually wear and tear kind of problems, so occurring over time.
First, he wanted to put me in therapy to just see that if it was something that could be worked through, rather than having to resort to doing MRIs and/or surgery.
We tried him with a course of therapy, and the tip-off that he was not going to do well without surgery was that actually he came back after therapy and was worse. So the therapy had caused him more pain than he started out with.
So after that didn't help, then we did an MRI, and it showed a tear, so we did surgery. Surgery was good. It was pretty easy. We went over to Salt Creek Surgical Center and went in the morning. They got a great team over there, and they kind of pre-op you, and then they wheel you in there and put the anesthesia on, and you come out and you wake up and you're all bandaged up, and they tell you not to move the arm for the next 6 weeks or so, and put a sling on you and head home. Mm-hmm. But it was a great experience. The recovery was far worse than anything else. It's long and it's painful. And when I started therapy, then the physical therapist for the first 3 weeks only could move my arm. In other words, I couldn't do it. The therapist had to do it, to manipulate my arm for me. And by little, your motion comes back, and then after you get your range of motion back, and then you work on strengthening so that you can get use of it, because just because you can move it doesn't mean you have any strength in it. And strengthening is, we're actually working on strengthening now to try and get it back to where it was pre-operative. The results is what spoke to it for me. Even the therapist said that, that the scar that was there was beautiful. It was very small compared to most that they've seen. So he did a great job of kind of closing you back up. And the fact that my recovery went so well, I think speaks volumes for his work. Anytime he needs me, I'll be there for him, because he was there for me.